Nicola here can talk about PS editing, as well as she can talk about CV editing, because she is very experienced with that, and she's edited like so many CVs, so many PSs till now.
Hi, everyone. I'm Nikhila. I'm originally from Hyderabad in the southern part of India. After graduating medical school in 2018, I just moved to the US to do Masters in Public Health because I was interested in research. And while I was doing the Masters in Public Health, I also finished my USMLE Steps. And now I'm a PGY-2 resident at Emory University, Atlanta, Georgia. It's in the southern east part of the US. The first thing is personal statement. Obviously, talk, a little bit about each one of them. So the first thing is obviously the length of the personal statement. So on an average, like remember, each program gets anywhere between 3,000 to 5,000 applications, and they try their level best even after filtering by scores and visas and other criteria to kind of try to read in detail all the applications of at least 1,000 people. So we have to make sure it's not boring and it's not the same as like other people. So an ideal length should be like probably like a 1 or 1.5 page. Half a page is too short because people probably will not know much about you. So 1 to 1.5 pages good. And next, the content.
Can I ask, like, what should be the ideal word count?
I would say like 1,000 words is a sweet spot. That is what I say all my whoever I'm mentoring typically. But it's not like you have to stay under 1,000 or anything. But a typical of like 4 to 5 paragraphs. And they shouldn't be like too big or anything. They should be spaced out well, and it shouldn't be ideally not more than 1.5 page. When I did mine, it was like a 1 1/4 of a page.
Yeah, I just wanted to interject, like so many people just feel like residents in and even like the PD, the associate PD, everybody is free. Right? We are not free, trust me. People work like especially internal medicine, they work 6 out of 7 days. They have to do night shifts, they have to do call days, 24-hour call days. Everybody is like has a hectic life, right? Even PDs, like, because PDs especially, like, they have to sometimes see the patients also, along with along with administrative activities. Chief residents also, they have to study their own stuff, they have to see patients, and then there's administrative stuff, right? And then they have to read your personal statement. So please understand that you have a very, very limited time with them, because they just can't give you a lot of time, right? So it doesn't, like, I was like, when I wrote my PS, it was like 2 pages long, right? And then I had to shorten it to a page long. So length is a critical factor. Like, the shorter you can make it for a certain emotional impact, for a certain storyful impact, the better it is. A page length, don't go more than, like, I feel like 1.5 page. A few people also write like 1.5 page personal statement. It's okay if you want to go along with that, but the sweet spot is a page to I feel like a page and a quarter of a page maximum. You should do that. I don't think like going beyond that is a good idea, because nobody has time, right? Even if, no matter how impactful it is, nobody is going to read it, right? Because they just don't have time. Thousands of applicants, right? As you already know. So yeah, sorry.
No, you're good. And another thing is like you can deliver the content you want without writing pages and pages. That you can make magic with words, literally, because typically, since most of us are not like native English speakers, it becomes a little bit of problem, because we have never done this, right? All our life we have just given exams and got scores and got into schools, and that's all we have done. But this is actually a thing that US medical students, or in the US, people do write personal statements starting in high school, so they're pretty good at it. So ours can probably never match as good as theirs, but we can do our best job and stand out amongst other IMGs. So that's the important part. And content, like, what are you even trying to say? Because I when I review personal statements, I tell students that, okay, you have like good points here and there, but it doesn't flow well. So you gotta tell them what is what is important to you, why are you applying to that program, and what are your experiences so far that made you choose this career path. Say like me, why do you want to apply to family medicine? That is what they should know, and why in specific their program. But then you could ask me, oh, we are applying to 200 programs, and how is it possible to tailor the content? You need not like mention the program name and the thing, but you could still say your program is, a good fit for me. But and that you can be, it's a pronoun, it can refer to everybody. And you can tweak it a little bit, and I'll make two versions of it, one for the university programs and one for the community programs, which a lot of people don't know. So when you upload documents on the eras, you can upload multiple documents. So when you're assigning them, that's the thing, when you're assigning, you can choose to assign this personal statement or that personal statement. I don't think a lot of us know that we can do it such a way. So that is another thing that we can do, and the content is like the most important thing. Yeah, Manik.
I definitely agree with that. Like, you should have a template that is separate for community programs, where it is more patient care focused and not research or scholarly focused, right? Because they just can't like that. Again, it all comes back to the fit. Remember, the fit thing is, if they feel like you are a bit intimidating, you're more academically oriented, and they are more patient care oriented, right, and cannot provide you that experience, then they won't even interview you, because there are so many other people who are like that, right? So when you are like submitting your PS, remember, for community programs, try not to mention a lot of research. You can mention maybe a line or two if you do want, but I would not recommend it. Rather be much more like, I want to provide, like, I want to be a service to humanity, or like along those lines, right? Talk about your patient care experiences, what made you who you are right now, experiences with patients. With something like a university program, I would definitely mention research in a way, just to show that I'm very interested in the specialty. So make different templates, and you can just change names later, right? Yeah, yeah, it's okay.
Yeah, so the next thing is, making sure it's, grammatically good. We definitely don't want to, write something that, they cannot comprehend. So that is like really important. And then the one thing that a lot of IMGs fail to do is like describing their life experience. They have like this beautiful, beautiful life experiences, but they never, tell it or, never even discuss it during interviews or write it on their personal statement. I've heard like beautiful, beautiful stories, like literally, IMGs who were like, doing farming in their village, and how from farming they got into medical school. Like say their, your dads or granddads were farmers, and they could do like a whole farming by themselves. And, and from there, how did they reach medical school, and how hard it is, to reach to medical school. Because, all of us give this, medical entrance exams, like NEET, and, all those exams where like hundreds and thousands of students are, appearing for those exams. And you have like very few thousands of seats, and how hard that process is, and how hard you have worked for it. Sometimes you spend like 1 or 2 years in additional to your after your 12th grade to do that. So but overall, discussing significant life experiences. Sometimes some people have like tragic life experiences, like somebody passing away, and how that determined them to get into medicine, or how they want to do a specific specialty because they've been like so inspired during their experience as an intern or during medical school by seeing very challenging cases, or whatever has driven you this far is what you have to put it in there. And another thing that you have to definitely discuss is what your career goals are. Like again, for community programs, you would probably not mention much of research, but you could still say, these days, like there are very distant remote sites that are still doing research. And when you do community based research, if it doesn't need to be like a very big clinical trial where you're enrolling hundreds and thousands of people, but it could be like a very small like a health session, teaching about diabetes. That is also like community based research, where you can include MAs and like healthcare workers, and all like midwives and all sorts of those people. But either ways, you got to tell them what you want to do. Do you want to be on the academic side, or do you want to be doing community based, like, or clinic based medicine, or you want to be a hospitalist, or you want to do a fellowship. Even if, it doesn't matter, like, what fellowship you want to do, it's fine if you don't decide, because a lot of us don't. And once we are doing the residency, that's when we kind of decide what to do. So these are all like the main things. Yeah.
Yeah, chiming in, because you said fellowship, and here's a very important point. Don't, let's say you're applying for internal medicine and you love cardiology, don't just focus on cardiology, because the issue, like, I've talked to a lot of residents here, and they've interviewed a lot of people. Yeah, and this like resident that I know, he's a really good friend. He told me the story of one of the applicants that he interviewed that he did not rank. And the reason he did not rank them is because during the internal medicine interview, he was all about cardiology. He was obsessed with cardiology. And I was like, but that's a good thing, right? Like, because he will get into your program and get into cardiology fellowship. How is that bad? And he had a very interesting point. He's like, okay, this person is all about cardiology, doesn't like any other specialty. What if he's on a nephrology rotation and then he hates it, right? If he hates other like, who, like, he just said, like, he's just into cardiology, not into any other part of medicine, that is going to be such a burden for a program, because he's gonna hate every other specialty. Nephrology, he doesn't like, he would not want to do that, right? So why should I rank him? Very good point. So even if you're mentioning a fellowship goal, don't just be upon, like, during your interview or even your personal statement be about, like, let's say you're applying for internal medicine, you're like cardiology. Don't do that. You can mention it in a line, I do want to do cardiology, but don't be like, okay, I don't like anything else but cardiology. I'm pretty sure about that, right? It is even okay to not mention any fellowship goal. You can say that I just want to graduate, that's it. But yeah, the point that I want to bring across is you're interviewing for that certain residency, not for that fellowship. And understand that the PDs or people who are actually selecting you are not fellowship directors at all. They have a different directors for fellowships, right? They are the residency directors, and they care more about you being interested in a certain residency than the fellowship, right? So please keep that in mind. I have done that error. I was like child adolescent fellowship. That's what I'm going to do. And it might have impacted my performance in other interviews where they might not have liked me, because they were like, what if he's all about child and adolescent? He doesn't want to do general. Why should we take him? Because he's going to be such a burden for us, right? So please remember that that it is a double-edged sword. Some people are going to like the fellowship answer. Some people might not even like it. So please know that, like, it's better to mention it in a line, not more than that. You're interviewing for the residency, not the fellowship, right? That was my point.
Yeah, definitely. We would say probably fellowship, or, things like that. I might consider a fellowship and things like that. But definitely, you have to remember that you're doing an internal medicine interview or a family medicine interview, or, whatever the primary specialty is, and not like the subspecialty interview. So that is very important. And another thing that we say is, like, should I address my low scores? I personally would say, don't dig your grave. Like, literally, if they don't think that your scores are low, because each program has like different cutoffs. That is another thing that IMGs don't go by. They're like, oh, what programs did you apply to? Or they just get this list of programs from their seniors or friends, and then they apply to the same programs themselves. But the thing you have to do is you have to look for those programs. You go up to their program websites and see what their requirements are, because some people, definitely you would filter out visa versus non-visa sponsoring programs anyways, but you also have got to see what their criteria is. Like, some people want like 3 LORs. For example, a lot of programs in family medicine want 2 LORs from the specialty of family medicine, which a lot of times people don't have. So that is important too. And some people have cutoffs like passing scores. Some have like, okay, we need like 210s at least. So you got to see, and then you got to see the mix of residents too. So sometimes they can just say all that they want, and then if they have not taken any a lot of foreign medical graduates, or if they're not sponsored, if they say they sponsor visas, but if you see there's like probably they haven't sponsored much visas in the past, the chances are less likely that you could get into that program. But then again, I won't say it is because it's less likely, don't apply for it, but it is like a pro and cons situation of how much money do you have, how many programs you can afford to apply. But you should definitely apply to the programs that could fit you. And that is why, so since the program cutoffs differ from program to program, I would not say, hey, this happened with this is why my scores are low. So this is not something that is really advisable, because who knows, some random program that you're interviewing, maybe you're in the top 25 percentile of the in terms of scores in the candidates that applied to that program, right? So if somebody comes up with it during the interviews, that's when you address it. And I mean, if there is a fail attempt or something, then that's a different situation. But then to I would not always mention it. It's like a both pros and cons, like it's like an individual scenario leading to what kind of circumstances led to it, or how many failed attempts are there, and stuff like that. But definitely, unless people bring it up, you should, all they're looking for is overall confidence. Like, they don't want somebody who doubts themselves, because as an intern or as a PGY2, or at one point there are residencies, like in the residency program, when you're on call, you're by yourself, and probably you won't have your seniors, and you have to make like life-changing decisions at that time on yourself. So if they notice that you, either during the personal statement, or by reviewing your CVs, or or during interview, that you are a person who doubts yourself and lacks confidence, then probably they might not rank you higher, because they want people who are easy to work with, who are confident about themselves, and overall, like definitely a good fit for the program. So those are the main things. And the next thing that you should consider mentioning is future plans. Like I said, whether you want to do like a community-based practice, or you want to do academics, especially then that would change in terms of, say, if you're applying to a university program, you could probably say, I like academics, I like teaching residents. Because also remember, as your residents, there are medical students that are rotating with you, and you have like plenty of opportunities to teach. Nowadays, like many programs have like these PA programs and NP programs, and they're like sending those students as well for residents to teach. So those are all the things that you want to mention there.
Yeah, I would definitely do that. It's called residence as educators. So Penn State has that. I think a lot of universities has that. And the purpose of residence as educators program is to get you to teach medical students, right? And the reason it is so beneficial is because when you're teaching something, you're learning it better, you're like mastering that certain subject, right? As because you're taking responsibility for the certain subject, right? And then you're also teaching medical students who will learn more, right? So for academic programs, this is a big thing I would definitely put in, that I love teaching. And if you have any example, for example, you've taught, let's say, a certain lecture, mention that, right? If especially like during the interview. And you could also do that in your personal statement for academic programs, because residence as educators is a big thing in academic programs now.
And sometimes some people apply for two different specialties for whatever reasons, because they're like not probably sure which specialty they should go into and things like that. So at that time, your personal statement should be definitely tailored differently to both programs. And most commonly, people do apply commonly to both IM and FM, but then you have to kind of realize that the scope of practice for IM and FM is also significantly different. Which, for example, in IM, all you do is like treat adult patients, but in FM, you got to treat pediatric population, you treat OB, you do deliveries, continuity deliveries, you literally, like, you have rotations in every single department. Like for at least our program, we rotate in surgery department, we rotate in ophthalmology, ENT, like all sorts of. So FM is like a different broader scope, and FM is also mostly outpatient heavy compared to IM, because IM has like a lot of inpatient training, and then again, the fellowship opportunities are different as well for FM and IM. So you definitely have to cater and your personal statement to different specialties if you're applying. And also you shouldn't you shouldn't just mention it in like a word or so. I feel like family medicine is the program that matches to my interest, and then change the rest of it remains the same, and then you change in the internal medicine statement, you just change from family to internals. It got to be overall different, the way and everything. And out of keeping all this aside, think for yourself, what do you want to really do? Because even if you match and you end up matching in some place where you don't like it, it's pointless, right? Or even if it's a specialty that you don't like. So you want to be overall happy for the future. So if you don't like teaching, or if you don't like research, then then that's a different case. And if you are saying that you like it, then you're not fooling them, you're fooling yourself, because you won't be happy in that in future. So you got to also think, okay, is this something that I can get away with it? Is this something I can totally not handle, or not like it at all? I can probably not survive in this setting. Which, for example, in my case, I was like, I would like to do the least amount of inpatient medicine as possible. So which is what pushed me more towards family medicine, so so it depends on, overall what you want to do, what your career goals are, and what, and of course, as IMDs, it is important for us to match and all of that, and there's this whole stress coming with it. But then trust me, if you match into something that you don't like, or program where people are not nice, then it is really it's really depressing, because I personally know, some of my friends who did that, and they regret, they don't like getting up and going to work every day. So you definitely don't want to do that. Yeah, so let's move on to CV. So, and like, what are I think, do we have enough time for a chat, or I think I'll probably proceed. So yeah, the next important document is CV. Also, like a lot of IMGs, we never had to do any CVs until we do USMLE, or prior to that, what we don't even know what to mention in CV, how to write a CV, and what are the differences between a resume and CV. True, right? So for ERAS, at least, you need a CV. So typically resume is something that is typically like a page long, which kind of highlights all your achievements and everything, and it's short. Basically, CV can go on for pages. It depends on how good experiences you have, and say your CV may be 3 pages long now. Maybe when you're 50, your CV could be like 10-15 pages long, which but for ERAS, since it is CV, that's a good thing for us, because we don't have to choose on prioritize, what to mention and everything. So, but what are the things that you typically include in the ERAS CV, and which I think it auto populates anyways when you're doing the ERAS application. So first thing is the education. So you mentioned your education, your medical school, if you have any extra graduate degrees, or everything basically. So you definitely have to mention all of that, what medical school and everything. And the next thing is work experience. Another thing that people get confused is, do I put my rotations under work or clinical experience? So I'm like, so any work experience is something that you get paid for, right? So if you got paid for shadowing, whatever, most likely we have to pay them in back. But if you got paid and you were doing some clinical stuff, put it on the work experience, which is very less likely for a lot of IMGs like us. So work experience is something. So you might have worked for, a part-time job or something, things like that you would put. Or maybe, sometimes when people graduate from medical school in their home country, they work in a local clinic or a hospital for some time. All those things you would put under work experience, because you were delivering patient care, but you were also getting paid for it. And the clinical experience is all the rotations, observerships, electives, all that you have done. So you would definitely mention all of those. And I will come to the description of all of that. So when you mention it, it's not just that, okay, attended meetings, attended Thursday morning noon conference, or like noon conferences, attended didactic. No, what exactly did you do? What kind of patients did you manage patients with cirrhosis, or like whatever department that you're rotated in. What are the things you did? Or if you assisted in like any surgical procedures, okay, performed. And or like if you did it by yourself, you would say perform so and so surgical procedures without supervision, with supervision, or assisted, all those kinds of things, for all procedures and surgeries. So the description really has to be clear and proper. It can't be like, okay, rotated in so X and Y hospital from June to July, and with one attending on inpatient medicine. No, that's not telling people what you have done in that medicine. So you could say, I rotated in this hospital, I've taken care of patients with, heart failure, or, arrhythmias, and, manage these conditions. And then what are the procedures that you perform? Did you do, you obviously would, depends on whether it's an observership or elective, whether or not you did charting, whether you did patient note, all of that. So then that kind of gives them, a back idea of, oh, this person already worked with Epic. So that's a for those then they know that you already know Epic. Then it will be easy for you to be a resident in their program, because they've also probably use Epic. Some people use Cerner, or an older, that's also called PowerChart. It depends on what different programs have different electronic medical record system. So if you mention whatever you used, then they kind of know. And does that mean that they won't take you if you worked on a different EMR? No, definitely not, because it's not, once you have started using one EMR, it's easy to use other EMRs. It is like it's not like a big learning curve or anything, but at least they will know that you have prior experience working with electronic medical records, because a lot of us are not in home countries, we don't have medical records electronic, and we don't do any of this stuff on computers. So it kind of gives them an idea. So you are literally telling them what you are competent about, not just that, oh, it's not like checklist, oh, I have 3 rotations, 3 LORs, I'm applying for the match, I need to match. No, what did you do in those 3 rotations? What do the LORs tell about you? There's like all these play a very big role in your match. And then another thing is volunteer experience. Volunteer experience is, again, people ask me, oh, what do I do? What do I mention in volunteer experience? Some people some people ask me, how many volunteer experiences should I mention? I was like, how many have you done? It's not about how many you're mentioning. How many have you done? And how many? So say you have, distributed food for homeless on like one day, but you also have like a weekend, like a free clinics that you have participated in, or something that you do routinely on a weekly basis or a monthly basis. I would say those will be more prioritized than like one day events where you just organized a conference for a day or something, or maybe just giving food for homeless. And do volunteer experiences have to be in medicine? No, not necessarily. They could be anything, and anything that you do service to the humanity counts. And it is up to you based on what kind of experiences you have, so that you can choose what are important for you, and what do you think can interest other people more than especially if you have a lot of them. If you have like 3 or 4 and haven't done much, then I would say put all of it.
Yeah, a question regarding the CV. So like not a question, just like a remark. So there is a certain thing called as CV inflation, where what a lot of candidates do is they'll try to inflate their CV with tons of experience, which they cannot talk about, which is the biggest issue. Because the issue, like it happened with me, like I was guilty of this match season because I did not know about this. So for example, if you have done a certain volunteer experience, right, that you have done, I totally understand that, uh, some kind of HIV drive, which I did, right, and you don't remember anything about it, you weren't even passionate about it, you just did it for like half a day and went off, but you were like, it's a good idea to put it in my like CV, and then, right, like I can talk about it. But what happens in the interview is they'll bring it up, and if you cannot talk about it, it'll look so bad on you. Because if you cannot talk about that one experience, well, that kind of destroys the validity of your CV. Because if you cannot talk about it, well, what about everything else that you mentioned? Like, could that be a lie, or were you not passionate about those things? Why you even mentioned it, right? So
it makes them like less, it makes you like less trustworthy person, because
yeah,
you're like almost faking something that
you
you could have actually done it but don't remember. It's easy for us to forget things that we have done like 10 years ago. It's hard to remember. So definitely, we have to mention the things in the CV that we can talk about.
Yeah, so please don't mention any fake information, because it's going to be brought up. And when you tell them the story, right, they will know if it's real or not, if you have done it or not, because they know. Like, they've interviewed thousands of candidates, they know, right? Like, based on like the whole story, they'll know if you have done it or not, right? If it's even research, a lot of people fake research that they publish this. So what a lot of people do is they'll get their name into publications, they've not even worked upon it, somehow they'll get it into it, and then a PD brings it up, right? Can you talk about the certain research that you did? What did you do? How, like, based on the way you talk, they will know. If you know certain things about research, if you bring certain points up, they will know. If it's like you participated, they will know. And if they feel that you haven't, well, you've dropped down ranks in the rank order list now, because you're not trustworthy. So being trustworthy is one of the, like, because again, she said, right, they want somebody they can depend upon, right, who's easy to work with. If you're lying there in your CV, you'll lie somewhere in the residency, or which is an issue, right? And there's so many other people who will tell the truth. So you're out a lot of the times. So please remember that whenever you're creating your CV, it is better to mention a few impactful experiences than to artificially inflate it with things that you haven't even done, or you have very slightly done, or you weren't passionate about. Please don't mention information you weren't passionate about, you don't even remember about it. And whatever you do mention about, please have your story revised in your head before the interview, because that CV is gonna get brought up, and you have to justify a few experiences, you have to talk about them. Please make sure you have your story straight if you have done it right, so that'll provide them like with the info that you are trustworthy. So that's important.
And also, one thing that all IMGs should know is it's not a competition or comparison. Like your friend has like 4 clinical experiences and like 6 volunteer experiences, doesn't mean that you should have that many. Whatever you did, as long as they're worthy, and as long as you can talk about it, that's good. It's like, oh, you should minimum have like 3 LORs. That is like a program requirement. That is true. Whatever program has requirements is good, but the things that you put on CV, it's not a competition. So quality is more important than quantity. The next thing is hobbies. Obviously, the hobbies are it could be sports, it could be whatever you do, because lots of times I've seen people mention, oh, I reading books, and then they ask you, what books have you read, and they can't come up with a book. So it's not just because if all you do is watch TV or watch movies, which I did all my life, just mention it. Don't mention because something just to look cool, even if you haven't done it. Because I probably literally the thing I mentioned on my CV was I've watched a lot of movies and I've done dance, and then they're like, what do you mean, like what kind of movies do you watch? And they brought it up, and I mentioned, what, I probably watched like 100-150 movies in the theaters, and then they were like shocked. Really? Like, yeah, that's like in just 1.5 years of medical school. So you can bring up like anything interesting, and that can, anything that can start a conversation and keep them interested in it. And like, for example, I told them I had a clothing store that I started online, and that I ran on WhatsApp, and every single program director that I interviewed with asked me about that clothing store. They have like, I had like publications, some people didn't even care about it, they wanted to know about the clothing store. And I've seen like literally people mention to me that my residents and all the other people I know, once it seems like a resident or an applicant was talking about fishing, and the program director loved fishing. All they did was talk about fishing throughout the interview, and then he matched there, and now they go fishing together.
Yeah.
So it's you never know what because that hobbies is one part of the application that we don't give like a good concentration, or you just fill it for the sake of it, or you just like say cooking, or sometimes you just say cooking other cuisines, and they're like, what cuisines do you cook? And if all that you cook is Indian and not something else, then it looks bad, like so you have
Yeah.
anything that you mention should be something that you do, even if it's like very I've seen people who mention this game called Coco, which is like a sport that is
Yeah.
played in India, and they'll be like, what's Coco? That's an interesting conversation, because these people don't know that. You watch, like, for example, I've watched cricket all my life growing up, and people don't do it in the US, but still you could mention cricket. So things like that, anything that is interesting but true, and again, you should be able to have a conversation about it, because hobbies show the things that you're passionate about. Because some people do painting and arts and stuff, you could mention that and talk about that. And even if if they ask, like, you could have, like, say, behind the wall, you could hang a painting of yours and say, oh yeah, I like painting, that painting is the one I've done. Because that's the beauty with like virtual interviews, you can set your room to the things you want to talk about. Yeah, sorry, Manik, go ahead.
No need to say sorry. Yeah, that's what I was gonna talk about. Like, so let's say what I did in my interviews is I placed a guitar behind my back, and PDs definitely brought it up. Like, I couldn't play it, but I just, like, I was quick to mention that I learned new skills. So I'm a big fan of learning new things, right? So I was like, I'm just learning guitar, I can play this song, and I did do that in a few interviews, like where I played a very bad song, but they liked it. So, but my point there was, I like learning new things, right? Because I am a novelty seeker, is what you called it. Like, you seek novelty, you learn new things. Like, maybe it may be juggling, it may be like whatever, right? So I from that one topic, I could bring out a plethora of topics. I'm into mindfulness. That is something I'm learning about. And they were like, okay, let's talk about mindfulness. And I could go like 15 minutes, 20 minutes about it if they want, right? So you could also do that. Let's say even if you don't play the guitar, you could definitely put it right. And if you know to play a simple song, it is definitely fine. You can talk about like how you're learning a new skill, because they love that. It shows a sign of lifelong learning. Like you're not just somebody who's just all about academics. You're somebody who is a whole person. And remember that in a residency, we think about these people in residency, like in Emory, Penn State, all of these, as people who are gods. They have no hobbies, they don't make errors, they are people who don't drink, right? Like they're people who don't enjoy life. It's not like that, right? These people are extremely casual a lot of the times, and they will like in my residency, we make fun of a lot of people like together, and like in a good way, not in a bad way. We have fun, we make jokes, silly jokes, right? And we go out, like we have a nightlife, we have all, whatever you think of, we have that, right? So please understand, people are humans and you need to connect with them, and it is not just about academics. Please bring out your hobbies, your passions, even if it's sports, anything silly. It is absolutely fine. I remember in one of my interviews, somebody brought Attack of Titan, which is something I really like. It's an anime. I don't know if you guys watch it. And another resident, like it was in a pre-interview social, he also loved Attack on Titan. And trust me, when this person brought, like, he's like, what do you enjoyed? Yeah, somebody's like, I love the show. So somebody yeah, so it's a new show, it's a great show. So somebody like who I was interviewing with, he brought it up, right? And then the residents loved it. And I was like, I should have brought that. And like that's when I noticed, like, the whole interview process is not about just being an academically well-read person. It is much more about being a person holistic and showing it can be anything, Attack on Titan, whatever you want to bring, please bring it, right? Don't just be authentic.
Yeah, actually, in the interest of time, we'll do it fast because I think I have a two-hour limit on the webinar.
Okay, let's do it.
This is the first time I'm like doing a webinar, but I think I have a two-hour limit, and I think we started at like 9:40 or something, just to wait for people, just to test.
I lose track of time. I'm
yeah,
sorry.
no, we'll see. I just remembered it because I just saw it. No worries. So the last thing is, publications. Again, like, like Manik told previously, it's important to, about the publication that you have published. If you have not participated in still published it. And ideally, I would say, mention all the publications that you have worked on. And when it comes up, you got to talk about it, whether you have published in whether you've worked on data analysis, whether you've worked on drafting, or whether it was the idea of the research that you brought up and you worked with colleagues and stuff. So don't just have your name get added into random publications, and because even if you don't know those people and you don't work with them, and it can look bad, not just right now, it'll look bad later in the following years throughout your career. So you got to work on something, and it's fine even if you don't have like a lot of publications or you have none at all. Just be honest about it, because a lot of primary care programs, especially community programs, they don't care about research. I had like six or seven listed on my CV and nobody talked about it. Like 80%, like all the community programs that I interviewed, nobody brought it up, and they were even like from big journals, and one person didn't even know that literally. It was like so funny. He asked me, do I work at the CDC? Because I was like, no, I don't work at the CDC. Like, because I worked with one person on a publication at the CDC. I told him that 3 times during the interview, and all he got was, I work at the CDC. So I was like, okay, you think whatever you want, but I don't work at the CDC. So sometimes people don't even understand or know the depth of research, and so that's important. Definitely mention what you have done. So next, coming to LOR. How many LORs do you need? Again, at least 3. That is what most programs ask for. And sometimes it doesn't hurt to have a 4th LOR, because I think 4 is the maximum that you can assign for any program, at least like from what I remember from my application. Correct me if I'm wrong, Manik. But
yeah, it's 4. Yeah.
4, right? Yeah. So you if you have 4, assign 4, and if you have 3 US LORs and you can get 1 LOR from home country, get it. It doesn't hurt to have a 4th LOR. It's not a checklist. Again, get 3 and stop there. If you have if you know very good attending at your medical school who can give you a good LOR, just get it. You can always have 4. And also when you're applying for different programs, some research heavy versus non-research heavy. Again, you can upload n number of LORs onto the ERAs. It is all that matters is what you are assigning to each program. So when I was assigning, I assigned like my research heavy LORs to some programs, and the clinical heavy LORs to other programs. And is it fine to have just one out of those 3 LORs as just plain research LOR? Yeah, that's good enough. One of mine was like that. That person wasn't even a practicing clinician, but he gave me an LOR based on how I was doing at research and all of that. So it's good. And you can get LORs from the clinical experiences as well. And that LORs, the content obviously depends on what you have done and how they assessed you and all of that. So they will put everything in there. And then home country LORs, just like I told, if you have home country LORs, get it, assign it. Again, ask for, and again, waived versus non-waived. So waived are, more like weighed heavily than non-waived LOR. So always ask for a waived LOR. And then, yeah, final thing is ask to upload very early, because remember, all these attendings are very busy. They might even have another set of students rotating with them, just like you did with them a couple of months ago. So it's important to ask at least, just so they get uploaded on time and you don't freak up about it in like the last minute when it's like time for the application. So it's LORs are very, very important, because it's literally, even if you're babysitting in US, people do ask for references. Every single thing.
Yeah, that's how US is.
Yeah, that's how it works. Yeah.
Somebody is asking what is waived.
Oh yeah, waived is something. So when you're attending uploads into the portal in the ERAs, you won't be able to look or read it what they have written, and it goes directly to the programs that you have applied to. Well, non-waived is you can also see it. So I would say waived are valued higher than non-waived, because when I was interviewing, people have brought up that, hey, this person has written very nice things about you in the LOR, and I never knew that person talked so much about me. I didn't expect, it can feel that they're like vouching for you, literally. And because again, like, we are all strangers to these programs, right? So they are taking you based off of somebody else's recommendation, literally. So those need to be done very well. Do you need to upload LORs before September 28th? Yes, because any document that gets uploaded to the ERAs, I think they have like 2, 3 or 4 days of processing time, and then they get like a green check mark or something. So the sooner the better.
A month before is what I would advise, because sometimes it can take even 14 days. So I feel like a month before is a good like period safety window, right? At least 15 days before, like September 28th, because I got my first interview, and the date of the interview was October 4. Remember, September 29th, October 4. If I did not have my LORs in place, would not have gotten the interview. So if you can get,
and it would be like your application would look like it is incomplete if the LORs are not uploaded on time. So the sooner the better. So what I would say, the things that you are working on are next priority compared to the things other people are working on. For example, LOR, somebody do it for you. The MSPA, somebody else does it for you. So work on those things first, because they are not in your hands. They are uploaded based on what their timeline is and whoever is doing it. So you should work on those first compared to PS and CV. I mean, don't wait until the last minute to write your PS and CV as well, because it needs but those are like first priority, even come on top of PS and CV. And yeah, research LORs, if you have them, you can upload it. And yeah, and another thing is like MSP. A lot of IMGs think MSP is not very important, but the thing is, it does, and they do definitely read it, and they do definitely look at all the information in there, and what are your scores and percentages, and what people have mentioned about you in the MSPs. Because especially when you have like mediocre or a little bit of lower end scores, they kind of see how good you were a student back in medical school, because nobody wants somebody who has like low scores on steps as well as low scores in medical school. But then again, nothing is like a checklist criteria. For example, if you take a medical school exam or a postgraduate entrance exam in India, like NEET, you get a certain score, then you're good. you match. So that is like you've met the checklist. USMLE, there's 100 different parts of the application and each one plays its own role. So you got to balance everything together, and everything should, on time and as well as in quality as well. And, uploading MSP is also very important. A lot of times, it's those clerks or whoever, people in our medical school that upload these documents for us after getting signatures from, medical school HODs and stuff. So you gotta, catch hold of them and make sure they do it on time. And that should also have like good, proper content and grammar as well.
Thanks, Nicola.
Oh, thank you.
Yeah, thank you for taking out the time. So bye.
Yeah, bye everyone. Thank you all for joining.